Good morning and welcome to the Town Meeting Talk Show. Seems like a while since we've done one of these, so it's good to be back at it because we like bringing you valuable information, and today's is pretty important as we visit with Dr. Zink, a name very familiar thanks to a certain medical virological incident that occurred a few years ago that some of you may remember. Dr. Zink basically became the face of Alaska's response along with the governor. And today she is our guest on a different subject, although somewhat related, having to do with providing adequate behavioral health services to Alaska's youth. We'll learn about the Behavioral Health Roadmap Project. This show, by the way, brought to you by Cordova Wireless Communications, your local cell phone and wireless data provider, providing your local talk show so we can get information like this out to you. And again, this is a program that we do on an as-needed basis. We don't just sit here and vamp for no reason every day, seeing if somebody wants to call in. We tried that for about 25 years and realized this is not a good use of anybody's time. But we're always happy to do one when something comes up, and those ideas can come right from you. If you want to be a guest or suggest a topic that should be covered in greater detail than we can do with a public service announcement or something like that. And Cordova Wireless Communications makes that possible for us. So what we're going to focus on with Dr. Zink is this listening session that's coming up. So a large roster, actually, of state officials can hear from communities around Alaska about their experiences in accessing behavioral health services for youth in their region, and maybe offer recommendations for improving that access or providing additional support and services in the Alaskan healthcare system. They say this information gathered during the session will help prioritize recommendations for improved behavioral health resources in our region, ultimately informing a statewide roadmap. And that's the name of the project, the Behavioral Health Roadmap Project for Alaska Youth. They have a website, by the way, bhroadmap.alaska.gov. And any of you listening to the delayed version of this on our YouTube channel, youtube.com/Cordova TV, I tried to put the QR code in the image of the video. So hopefully the technology will work out with that such that you can maybe scan that. But again, BH Roadmap, it's not a real hard address to remember. BH for Behavioral Health, bhroadmap.alaska.gov. And while this session is going to actually be held in the Mat-Su area, people from around the region, and in this case it's Mat-Su, Anchorage, Kenai, Kodiak, Cordova, Bristol Bay on Alaska, and Valdez, anybody can share their thoughts on the adequacy of behavioral health services for kids. And as we'll learn, it's not just family members. They want to hear from children and youth, and also parents and grandparents and guardians, family members and caregivers. But it really, as you'll hear, can be anybody. If you're a business owner that has seen situations where youth are behaving in a way or perhaps suffering in a way that participation by behavioral health specialists might solve a problem. You know, maybe you've got a young person that comes into your store or that you interact with in some kind of youth group or something, and you think, boy, it seems like a certain type of counseling might help this kid deal with some of the things they're telling me that they're dealing with. You're welcome to speak up too, so it's not just family, it's anybody. So it was a really interesting conversation, and I'm glad we get to share it with you now on the Town Meeting Talk Show. Dr. Zink speaking with us about the Behavioral Health Roadmap Project for Alaska Youth here on KLAM. So, Doctor, did you hear the one about the doctor who was appointed by the governor to do a certain job that turned out totally to not be what she probably thought it was going to be?
I've been hearing rumors about that one recently. It's got a good ending.
The last time you and I talked, it was in such a flurry that we didn't even really get to say hello or do introductions or anything. So I assume life since you-know-what has been a lot calmer for you?
Yeah, no, different challenges and obstacles. Our department's mission is the health, well-being, and self-sufficiency of every Alaskan.
Yeah.
So turns out there's not a lack of problems in that space to continue to work through. So
Yeah.
we continue to be busy and working with a great team, and working in Alaska is just fantastic. So, it's just a different challenge, a different day.
Yeah, and you don't have to be on TV as much.
Yeah, I don't have to be on TV as much. That I appreciate.
Well, now let's just real quickly here, because again, in the midst of the P word, we didn't really get to learn anything about you at all, which is something I like to do with our guests. So maybe just give me the highlights of how you came to be in this position. For example, have you been in Alaska a long time, or did you come to us more recently?
Yeah, no, great question. So I moved up to Alaska about 15 years ago. I actually came up here during college as a mountaineering guide and fell in love with not only the place, but the people and a specific person. And so after I finished my residency, I went to med school at Stanford, residency at University of Utah. We came back to Alaska because just really fell in love with the place. Thought I'd come for a couple years, and I fell in love with it even more and have really spent my entire practicing career here. I'm a practicing emergency medicine physician. I still see patients regularly in the emergency department. I actually have a shift later tonight, and quickly started to see that emergency department is where you saw all good public policy come to fail. And I realized that I couldn't care for my patients without caring for the larger systems of care. And we have a lot of ways in which our systems don't serve patients. And in fact, people have to work through really complex, really expensive systems. So that's really my passion. That's my interest. I really became involved in policymaking over the opioid crisis, mental health, and trying to figure out how to make, again, these really complex systems work better for patients. Because at the end of the day, the patients are my why. It's just public health and health policy became my how. And so I had the honor of stepping into this role in 2019, in July of 2019, really thinking that that was going to be my focus. Perfectly timed 6 months prior to a worldwide pandemic. So I was not really thinking that was on my radar, and really was actually not my focus in kind of coming in here. But sometimes, you have to deal with the hand you are dealt, not the hand you choose.
Yeah.
And really was honored to work with Alaskans kind of across the state to have a very different outcome than we had from the 1918 pandemic, and honestly, very different outcome than what many other states had. So worked through that space, but now really excited to be working back to my initial love and thinking about these other systems of care.
Good. Well, and this, behavioral health is something that's very near and dear to me. I was involved for a number of years with our local Sound Alternatives program with that board, and I'm glad to see some some focus on that, which brings us to the topic, the Behavioral Health Roadmap Project. Let's what is that about? What's the genesis of it, and what are you trying to accomplish?
Yeah, and I appreciate that question and just providing some time to talk about it, because we're really looking forward to hearing from Alaskans across the state. The governor really has this focus on healthy families that's built with healthy communities, healthcare access, and healthy beginnings. Those are kind of the three pillars within it. And as a parent, I know that, I'm only as happy as my most unhappy child. And I feel like that's true as a community. And so there's no better place to think about our future than to think about our children and their physical and mental well-being. We know that mental health challenges have continued to be a challenge in our state and other states, but have really been rising. Unfortunately, Alaska has the third highest rate of suicide in the nation, behind Wyoming and Montana, and we consistently have been about twice the national average. And Alaska has the highest rates for youth and young people suicide, really in that 15 to 24-year-old range. And we continue to see real discrepancies across our state as well between different rates of suicide, mental health. So we need to do more, and we need to do better for our kids, our children, our families, our communities, but then also our future. Our healthy economies are built with healthy people.
Yeah.
But we in the state government are just people, and we get to know the different parts of the system, but finding solutions to youth mental health are going to be an all-hands-on-deck effort. And so we are really going around the state doing a series of listening sessions, and that's what the Youth Mental Health Behavioral Health Roadmap is. It's a series of listening sessions through communities. We've really kind of chosen 5 major communities, tried to make it accessible both online as well as in person. And then we'll have a series of additional online options for people who can't make those events to hear about different communities' successes, their struggles, where they see opportunities, what they see as a vision for youth mental health in that region. And we're taking that input and information to try to think about the systems that we have at state government, what systems are locally available, what systems are available nationally to improve the well-being of our youth and to really meet that vision for the communities.
Okay. So then, again, the idea is for you to hear from regular folks about what it's been like trying to access those services, if they have faced barriers or if things have gone well, maybe things that you can duplicate in other areas if you find these success stories, but just really to hear from people who have needed behavioral health services for young people, sort of the pros and cons and what that's been like.
Yeah, that's exactly it. So each of our regional sessions has had a community listening session. So for the South Central region, that will be November 8th, starting at 6 p.m. It's currently being held in Matsu, but there is also an online version for people to be able to attend. Unfortunately, the time just did not allow us to go to every community, and we know that it's far for many, many people.
Sure.
But people are welcome to attend it online. And as you mentioned, it's to hear from community members. So it's a facilitated discussion. It's off the record, just hearing from. It's been really powerful. There have been very heartbreaking and very telling stories. And it can be youth themselves, it can be parents, it can be caregivers, it can be teachers, it can be policymakers, it can be troopers, it can be store owners, anyone in the community who feels like they feel strongly about wanting to share their perspective on either what they see as a vision for youth mental health, where they've seen barriers or where they've seen successes. We really open that participation. And we will also be having an online version for people who cannot make it that evening. So if your evening, Wednesday, November 8th is booked, we really encourage people to take a look at the BH Roadmap. That's BH for Behavioral Health, roadmap.alaska.gov website. And on there is details about this information and what we're doing. There is an ability to register and see the online as well as the in-person event. So that's how you can keep track of what's happening as well as sign up to participate.
You added something interesting to the list of things that I've seen for who is invited to participate in this project, because it looks mostly focused on family, largely, that, trying to find out from children, from youth, parents, grandparents, family members, caregivers, and guardians. But you mentioned, like troopers or just anybody in the community. It could maybe be a store owner or so it really is just anyone that's interested in this topic that has observations to share, not just family?
Absolutely. And we have gotten some really powerful and great insight from everyone from our village police officers to our troopers, as mentioned, to, our emergency department staff, our urgent care workers, like you mentioned. Some business owners have had some really insightful and useful perspective on things that can work and not work well. We know that about 80% of our health is determined by things outside of the healthcare system, including people's access to jobs and childcare. All of those things play a role in making sure that we have, really important protective factors for our youth, as well as building up services to help to support youth in need at that time. Healthy Alaskans 2030 is our kind of our state plan amendment. And under the mental health for youth section, there's a goal, and that's to make sure that every Alaskan child has 3 positive adults who care about them in their world. And that can really be anyone. That can be a store owner. That could be a teacher. That can be a trooper. That could be a neighbor. And so we all play a really fundamental role in youth mental health. And so that's why I really encourage anyone from any walk of the community who wants to hear more or share their perspective to join us.
Who's going to be joining you in terms of sort of being at the table and listening, or is it basically just you that is participating in this from the state side?
Oh, it's so much more than me and so many more important people in so many different ways. So that's been one of the other really great things about this is it's got a lot of our directors from multiple divisions as well as multiple departments. So not only is this the Department of Health, but this is also the Department of Family and Community Services. So, for example, Commissioner Koval, who is the commissioner of the Department of Family and Community Service, has been attending all of these in-person, live, and hearings. So she oversees the Office of Children's Services, Department of Juvenile Justice, API. And so having, leaders like her coming in person and listening make a huge difference to trying to figure out how to make the systems better. We have directors who are coming, some IT people who people oftentimes say, I just wish I knew which services were available. How can we make that happen? So, for example, the executive director of the HIE has been coming to many of these. Many community providers have been coming to them. But within the department, we have a long and robust list of staff who are coming and listening. And I will tell you from the inside perspective here, sitting at state government, it's been really encouraging to see how many times these stories have resulted in immediate change on things that are actionable right away, as well as real commitment to making sure that we have a timely, intentional path forward to address the behavioral health needs for youth and adolescents. So really having those kind of key state leaders hearing from community families is, again, part of the reason why I work in the emergency department. It gives me a really great grounding on what's working and what's not working. And in some ways, this is a chance for a lot of our key staff to be able to do the same thing regarding youth mental health, to be able to come, listen, learn, and be able to think about the systems that we are a part of and how to make those better.
Yeah, it's been interesting. And again, this whole thing is focused on behavioral health. And it's been interesting. There's, of course, been a lot of chatter, some of it politicized, of course, and some of it anecdotal. But the impact that the pandemic had on, I said the word out loud, that had on youth and their mental health, not being at school, more time on screens, a lot of, is there, what is your perspective on that? Did that whole situation lead to some very serious upticks in behavioral health issues for young people, or has that maybe been overblown?
I mean, I think for sure, different youth and different families have had different experiences. They had different experiences during the P word, as we'll refer to it, or different experiences, afterwards. And so some, had really strong communities and stayed connected and were able to be quite resilient to the time. But I think for the vast majority of our youth, and really the vast majority of Alaskans, that was hard and long and painful and isolating, and there are long-term impacts associated with that. We see that with every worldwide pandemic. We see that with every major challenge. It's not a choice any of us would have ever gone through, given the choice. It is what it was. But being able to be connected to community, being able to be connected to family, being able to be connected in person, really, again and again, the data shows is critical to our mental well-being, our health, and particularly our kiddos. And so kids who spend a lot more time on social media, there's good data from, there's a bunch of stuff that came out from the Surgeon General on the real risk of screen time and particularly social media for our youth and the risk associated with that. There's great data on the importance of being outside and being physically active. I love this quote by John Hyatt that says that the opposite of addiction is not sobriety, but the opposite of addiction is connection. I think that community and connection is inherent to who we are as humans, and it was really hard to maintain, and for many was lost during the pandemic. And I think we need to be mindful and intentional at rebuilding that now and doing all that we can to protect that in our communities moving forward.
Did Alaska manage to, do you think, be a bit more insulated from that, just given the nature of Alaskans and the fact that we're very community-minded people? We're kind of our own breed up here anyway. Do you think that we did better than a lot of more populated areas?
So, I've had the honor to be representing all the states and territories at the federal level for the past year, and I oftentimes get asked, how did Alaska do so well? How come your case fatality rate was so much lower? How did you get so much more testing? How come, some schools were in session all except for 2 weeks throughout the entire pandemic. They never went out of session. And what I always say is it's Alaskans' sense of community. It was Alaskans who found ways to be creative and resilient together. And honestly, I think how we recover for this pandemic is more important than even how we responded. And I think if we recover with a sense of community, a sense of connection, and a sense of really kind of prioritizing those values, building it into the structures that we do, just like we're doing with this mental health roadmap.
Yeah.
I think that we will be able to build in the lessons learned for the future so that we're able to really build in that community and connection moving forward.
Well, I always love to hear any situation where, the Alaskans being Alaskans helps us to weather challenges better than maybe some other places that, for whatever reason, don't have some of the attributes that we're blessed to have. And this idea of gathering people, again, it emphasized people from all different walks that are interested in youth behavioral health and have observations to share. It definitely seems like forward thinking, and I hope people will participate in it. This is the Behavioral Health Roadmap Project. The event is the 8th at 6 p.m. Is there anything about the meeting or the project that we haven't covered that you want to be sure gets in here?
Yeah, that's a good question. I think that it's important to know this is not a one and done. This is not, we're listening and then thank you very much, we're on our way. We're really trying to be very intentional about what we are calling internally as these arcs of effort, and making sure that we're kind of building them in to the structure of government moving forward. So really making sure that we're having ways for community members to be involved in the conversation and involved in the discussions. Going back to, again, that P word that we're trying to avoid. Some of my favorite times in some ways was the Zoom sessions on Wednesday that a lot of people would attend and ask questions, because when we got questions directly from the public, it made us better. It made our response better. It made the way that we saw things, because I can only see things from my perspective and try to learn and listen from those around me. And same with my epidemiologist, and same with the governor, and same with the commissioner. But we are so much stronger together when we can hear from different perspectives. And that experience through the pandemic, I think, was really part of the incentive for this behavioral health roadmap of really making sure that we're building in community listening time, knowing that that will make our whole response better if we're able to find as many ways as possible to work with community. So we have these community evening sessions, but then the day kind of before the evening session as well as the day afterwards, we're meeting with kind of key providers within that community, so hospitals, behavioral health providers, school teachers, and others, to do a much deeper dive into each region and talk through, what are the services offered, what are the real barriers, so that not only do we have these conversations, but we have really concrete, constructive things that we can come away from it to do today, tomorrow, the next year, the next 5 years to improve. Because at the end of the day, I don't want to admire this problem. I want to improve the problem.
Sure. Well, it's great. I know how busy you are, and actually, as we're speaking here on Thursday afternoon, you're up against another appointment. But one more time, just quickly, when is the event? How do people participate?
Absolutely. So the event is going to be actually in Mat-Su, November 8th, starting at 6 p.m. We encourage people to register beforehand, both if you're going to attend in person or virtual, because there is a virtual option. Mm-hmm. And you can go to bhroadmap.alaska.gov to register, both for virtual and in person, as well as see additional sessions. And on that website, you will also see the additional virtual sessions that are held outside of these regional ones if you cannot make the November 8th. And really, just appreciate you taking the time to have these conversations and get out the word.
Oh, sure.
Because we want to make sure it's an all-inclusive community event.
Yeah, well, and I mean, any time that you and I can chat about something, I always enjoy visiting with you, and am happy to do it again if something else comes up. So thank you, Dr. Zink, for the visit, and we wish you all the best with your ongoing busy schedule.
Thank you so much. Thanks for making your time, and thanks to the public for attending. So we'll talk soon.
Always delightful to have such a knowledgeable guest like Dr. Ann Zink on our program, talking about the Behavioral Health Roadmap Project for Alaska Youth. Our session coming up on November 8th, as she said, at 6 p.m. For us, it'll be virtual. So if you would like to register for that, the address is bhroadmap.alaska.gov. And if the technology worked properly, any of you watching this on delay on our Cordova TV YouTube channel, there should be a QR code that you can scan if the technology works, which, I don't know. But again, it's a pretty easy web address. We're talking about behavioral health, as in BH. So it's bhroadmap.alaska.gov if you want to register and be able to participate, because the actual meeting is in the Mat-Su area, but people from around our region here will be participating remotely. And a lot of people are going to hear what you have to say, a lot of important people in the process of designing how behavioral health services for youth work in the state. If you can think of anybody who you would guess would benefit from hearing this program that might not have, again, please urge them to go to our YouTube channel, youtube.com/Cordova TV, where this show will be archived. We try to do that with all the shows so nobody misses out. And, of course, we're able to do all of that thanks to Cordova Wireless Communications, which has been our sponsor for the talk show for, gosh, I don't know how many years. It's decades now. It's very valuable support so we can do this, and just a part of what Cordova Wireless and CTC do for the community. For example, bringing in millions of outside dollars that we don't have to do anything to earn other than just being members, which all of us with telephones are. And then that's money that circulates around the town and helps our economy. So that's a big plus, having such a locally focused pair of operations like that. And we thank Cordova Wireless specifically for their support of this program. We thank you for listening. If you ever have any ideas for a program, again, we really want you to let us know. We do this on demand. And somebody doesn't have to be a highly elevated official like Dr. Zink. It can be anyone with something to say who would like to utilize radio to get the word out. You are very much invited to drive the topics. So one more time, remember that web address, bhroadmap.alaska.gov, to learn more about the Behavioral Health Roadmap Project for Alaska Youth. The rest of your 10 a.m. hour programming is on the way, delayed and condensed, but still brought to you with the full vigor of our vigorousness. And until next time, this has been Town Meeting. I'm J.R. Lewis. Thanks for listening to KLAN.